21%. That's the percentage of Cameroon's population that has tried a hard drug at least once. 10% are regular users. And 60% of them are between 20 and 25 years old.
Wait, what?
Cameroon has the highest drug-related death rate in sub-Saharan Africa, more than triple its neighbors. And now, the mothers are rising. Cameroon sits at a dangerous crossroads, literally. Its porous borders make it a transit hub for international drug trafficking. But the drugs don't just pass through anymore. They stay. The Anti-Drug National Committee, the CNLD, paints a devastating picture. 21% of the population has tried a hard drug. 10% are frequent users. 1 in 5 school-age children has already experimented. Drug-related disorders have nearly doubled, from 18.83% to 31.82%. And among 10 sub-Saharan African countries studied, Cameroon ranks first in drug-related deaths, 3.21 per 100,000 people. That's more than triple the rate of neighboring countries. A 2024 survey in Yaoundé found that among the general population, 66% consume alcohol, 33.5% smoke, and 26.7% use drugs. Among secondary school students, the substance use rate hit 54%. So what exactly are Cameroonians using? Cannabis, locally called banga, is the most widely consumed illicit drug. It's cheap. It's everywhere. And for many young people, it's the entry point. Tramadol, a prescription opioid meant for severe pain, has become the drug of choice for motor-taxi drivers and young workers looking to push through grueling hours. It's not regulated properly. It flows in from Nigeria and other neighbors. Then there's cocaine and heroin, imported through trafficking networks, concentrated in cities like Douala. And the newest threat, synthetic drugs, kia, chai, and amphetamine tablets, are expanding the menu, especially in schools. 20% of drug users started experimenting before the age of 15. And now, something is shifting. When the state fails to protect, the people rise. Across Cameroon's Anglophone regions, a wave of grassroots resistance has erupted, led primarily by women, and it's unlike anything the country has seen before. In Tombel, women took to the streets in protest, denouncing the devastating impact of drug abuse on their community. They invoked traditional rituals and curses against drug traffickers, calling on ancestral powers to strike down those poisoning their children. In Kumba Mission and Mbeme, women marched through the streets dressed in black, a funeral march for their children lost to addiction. In Mbeme, they carried signs and sang protest songs, invoking traditional oaths against drug dealers. This wasn't just a protest. This was spiritual warfare. In Bangem, over 1,000 women mobilized. 1,000 mothers. 1,000 voices. One message, enough. But in Kumba, the women went further. They didn't just march. They physically destroyed drug dens, thatched huts where dealers sold to their children. Mothers confronting drug suppliers directly, tearing down their trading spots with their bare hands. In Mutengin and Taiko, protests grew so intense that the divisional officer was forced to ban energy drinks mixed with drugs, a rare concession won by community pressure. At checkpoint Buea and Mile 16 Bolifamba, over 500 residents joined the mobilization. And in Buea, something more structured emerged. In July 2025, a 36-member peacekeeping force was officially installed by the divisional officer and Chief Malenji Nopamwi. This vigilante group was sanctioned by local authorities to track drug dealers, sensitize them, and hand persistent offenders over to the police. But this story has two sides. Cameroon has a long tradition of jungle justice, communities taking the law into their own hands when the state fails. Police corruption. Judicial weakness. A justice system that doesn't deliver. When trust in institutions collapses, mobs fill the vacuum. The question hangs in the air, are these vigilante groups protecting the community, or risking a descent into mob justice? Women destroying drug dens. Traditional curses invoked against dealers.
Wait, what?
Officially sanctioned vigilante forces. These are acts of desperation from people who feel abandoned by their government. They are, at once, a sign of hope and a warning. So what must change? First, rehabilitation centers. Cameroon urgently needs dedicated detoxification and rehabilitation facilities. You cannot criminalize addiction and offer no path to recovery. Second, mental health investment. The current mental health infrastructure is a ghost. It needs funding, staffing, and reach, especially into rural areas. Third, destigmatization. People don't seek help because they're afraid of arrest, of shame, of being cast out. Treatment, not punishment, must be the default. Fourth, education. When 75% of youth can't identify the effect of drug abuse, awareness isn't optional, it's survival. Fifth, support the grassroots. The women marching in Bangem, the peacekeeping force in Buea, these movements need to be supported, not suppressed, and channeled into lawful, sustainable community action rather than potential mob justice. Sixth, border security and supply disruption. As long as drugs flow freely through porous borders, demand-side interventions alone will never be enough. Drug addiction in Cameroon is not a distant crisis. It is in the schools, in the homes, on the streets. It is in the bodies and minds of a generation. But it is also in the hands of the mothers who rose up. In the 1,000 women of Bangem who said enough. In the mothers of Kumba who tore down the dens destroying their children. In the peacekeeping force of Buea who said, we will not wait for the state to save us, we will save ourselves. The crisis is real. The suffering is real. But so is the resistance. And if you're watching this, share this story. The world needs to know what's happening in Cameroon. Not just the pain. The fight.